how do you approach a plan for each patient? Can you just maybe take us through one of your consults?
As an example, I would use a breast augmentation or a breast enlargement patient. Patients will come in, they'll do their intake questionnaire paperwork and be roomed by one of our nurses or medical personnel. When I come in to see the patient, the first thing I do after introducing myself is go through their medical history. Then I'll ask them basically, confirm the procedure that they're interested in discussing, breast augmentation, and I'll ask them, what are your goals? What's your motivation to have this procedure? Most of my candidates that are breast augmentations fall into one of two groups. They're either patients who never had a lot of breast tissue or small breasts, or a patient that might have had some volume but lost it for one of three reasons, either weight loss, pregnancy, aging, or a combination of the three, and they want that volume restored and maybe some help with their shape. So once I understand why they're there and what the procedure is that they want, I'll do a physical exam on the patient and take measurements and see if that procedure is actually a procedure that's appropriate for them. And if something else might get them closer to their goal that they didn't even know was a procedure that they needed, like they might think they need an enlargement, in fact they need a lift and an enlargement, I'll go into that procedure. So once we sort of understand, I understand what the patient wants, what their ultimate goal is, I'll discuss that procedure in detail with them, showing them pictures and graphics to help illustrate how the procedure is done. We let patients try on implants so that they can get an idea of how they might look with a larger sized breast. When that's done, obviously we talk about risk and telling patients what the risks are with the procedures. It's not my intention to scare patients, but once again, it's educational. This is surgery. Patients need to understand these things. And with that being said, once again, all questions must be answered. When you do that, the 5 components of informed consent are met. Patients understand what the procedure is, if they're a candidate, what their options are, all their questions are answered, risks are discussed, patients can make an educated decision. No two patients are the same. It's this attention to detail that assures that patients will get the best results and get the right procedure for them.
When I was looking to get my breast augmentation, I had recently just had my son, and I felt like they were very saggy. They weren't cute. And if you see the before and after pictures, it's ridiculous.
I
have. But when I was shopping around before I even met you, before I had my consultation with you, I felt so rushed, and every single doctor told me, you need a lift. And I was so worried because I was going to have that scar. And every single one was like, you need a breast lift, you need a breast lift. And I didn't want that. And when I met you, you go, okay, well, you can have no lift, no scarring, but we have to go a little bit bigger on the implant and maybe a little higher. Nobody even gave me that option at all. So that was amazing that you didn't rush me. We actually went over and talked about every single possibility that could have happened.
Well, many doctors are purists, and they'll make decisions based on measurements strictly. You may have, in fact, in some practices, been a candidate for a lift, but you and I discussed what the upside and downside would have been to having one procedure versus the other. And the final decision was yours. You were a candidate, in fact, for just a breast augmentation, but we discussed what that would mean. And we also left having a lift as a procedure in the future on the table. You made that decision based on all that information, and I didn't encourage you or discourage you one way versus the other. And that's the way I think it should be done. I think most doctors that are responsible and competent do it that way. If you're a patient and you feel like you're sort of being pushed in a direction without these things being explained to you, you're probably in the wrong place.
No, 100%.